watching the interview series with PCOS Club India, and today we're bringing a very special episode on International Women's Day. We have Dr. Ashima Shukla with us. Thank you so much, Ashima Shukla, for joining us.
Thank you so much.
For all of you who do not know Ashima, she's a senior psychologist and lifestyle and mind-body medicine expert. She is trained in integrative psychotherapist, practicing for over 18 years. She's the first Indian to be trained at the Benson Henry Institute for Mind-Body Medicine at the Harvard Medical School. Dr. Ashima uses an integrated and holistic approach to achieve optimal health and mental well-being for her patients. She's also certified in BAH, an NLP practitioner from Bangalore Institute of NLP, California. Her field of expertise includes stress, anxiety, women's health issues, lifestyle diseases, and holistic health. She recently opened Prana Institute of Integrative Medicine, and she also practices at the Artemis Hospitals in Delhi NCR. Welcome, Dr. Ashima.
Thank you, Nidhi, for having me in your forum here. And stress is a very relevant topic these days, and I'm glad that you've taken it up.
Thank you, Dr. Ashima. And I think since we're going to talk about stress today, it's really important that we are talking about the integrative medicine that you stress upon. In fact, when we talk about PCOS and stress, there have been a couple of many studies where there was a study which is called Depression, Anxiety and Perceived Stress in Women with and without PCOS by Australian Longitudinal Study of Women's Health, which showed that women with PCOS compared to women not having PCOS reported higher prevalence of depression. And there was another study, Psychological Distress in Women with PCOS, that happened in Tehran. And there were 81 patients with PCOS where 14% had extremely high stress, and there were 35% had high stress and 40% had neurotic stress. So we are just left with 10% who did not have stress. So there certainly is a relationship between PCOS and stress. So why don't you just tell our audience what PCOS and the stress could mean and how integrative medicine could help?
So stress, as we all realize today, is an inevitable part of our existence now, and it can come when perceived as, as simple as bumper to bumper traffic on the road, or relationships. It could be finances. It could just be any domestic help that they've not turned up. So the stress is part of life. But what is important is how do we perceive it? How do we receive it, and how do we respond to stress? Because most of the time we really can't do much about a lot of things around us, but what we can change and what can really help us is how do we respond to that. And that brings me to a very important aspect of stress, and that is a little bit of stress is important because it helps us to perform, to act. And we all know, we remember during exams or when we had to perform on the stage, heart will suddenly start pounding more and you'll be breathing faster. These are signs of stress, but this is good stress. And this helps our body to get ready for some action. And but if this response or reaction stays on for very long and the body forgets to switch it off, that's when it leads to health issues and chronic stress. And when I say this, it's very important to understand also that what is the response that happens in the body. It's a reaction called fight and flight response. So historically, man was a hunter, and they're supposed to, if they're in the jungle and forest and you encounter danger, which is real, your body is to prepare to fight and face the problem. But now there are no real dangers as lions, but we definitely have a lot of these stresses around us. So some real and some imaginary. Because even if your thought perceives something that can happen in the future, the body starts changing, the physiology starts changing, and we say we are in a stress response state. And what I'm going to also talk about today is how do you then change it into a relaxation response, where your body does just the opposite of this reaction. So you also asked about the depression part, the connection. So when you are in a stress state for very long, or when we say you're in a chronic state, chronic stress state for a very long, say more than 6 months, and you're not doing anything to deal or address it, then you might show some symptoms of low feelings, disinterest, or you might be eating too much. So that's the time when you can exhibit or elicit these emotions. And like you just mentioned, there are a lot of studies which say that there is a connection, and ultimately you might land up with little moderate or severe depression as well.
Interesting, Dr. Ashima. Once a woman starts to heal her PCOS, it is so important to know where her root cause lies. Learning from my own experience, I feel there were certain stress factors which I feel triggered the PCOS, and once I started to heal and sort of calm down and ignore those stress factors, it felt really helpful in my journey. And especially for us women who are epitome of being the perfectionist in the house, handling work, handling children, it has to be perfectly 100% right.
Yeah.
But what we tend to sort of hide is, the tiredness or the anxiety or stress that comes along with it. We do not know how to heal that perfectly. So how can women deal with that stress comes with that daily life that we lead?
So you're very right. I think women are very hard on themselves, and that's where they land up with being the perfect mom, the perfect wife and daughter, and that's a huge pressure. And so it's always best to address, pause, and listen to what's going on around you, and also listen to your inner dialogue. Most of the time we are talking to ourselves, and we live up to that label that we have created, either ourself or what our society is giving to us. That is, the family or the way we were raised. So it is important to address those inner labels that we are trying to live up to. Coming to being a perfectionist or doing the things in a certain way, that's a habit. And it can be changed also if it's not leading you to a very productive outcome, as in you are more stressed and you're exhibiting symptoms of anxiety, depression, irritability, anger, pains. These are all symptoms of stress. So coming back to addressing stress in the first place, I think I want to begin from, do we recognize the symptoms of stress in our daily life? So many a times we ignore the little pains that we have on our shoulders, stiffness in our neck, or just being irritable all the time, or having very low patience and not getting adequate sleep. You go to sleep but you are thinking 24/7, and as we all know, we get about 60 to 70 thoughts per day, and most of them are negative. So you engage with thoughts which are repetitive also. So you have to recognize and learn what are the symptoms of stress. They are not just health issues to begin with. They can become and lead to health issues if you don't pay attention, and you land up with lifestyle diseases in the long run. And chronic stress, if unaddressed for more than 6 to 7 months, leads to lifestyle diseases like diabetes, hypertension, there could be allergies, there could be migraine, all these things. And particularly for PCOS, it gets heightened. You will have more manifestation of the symptoms if you're not managing your stress well. Here at Prana, what we have done in the last 18 to 19 years when I've been practicing, I noticed that psychotherapy or counseling is very helpful because it helps you talk, and there is catharsis that happens. There's a offload of the baggage of thoughts that one is carrying.
Absolutely.
But if you have to address, as you mentioned, the root cause. The integrative approach is always the best approach, which includes lifestyle modifications. It includes eating right. It includes exercising moderately, regularly. It also involves thinking right and taking care of yourself well. And when I say thinking right, I mean positive thoughts. Things that encourage you, indulging in activities that will give you a little pleasure, and it will relax you. These things have a long-term effect on your health.
Dr. Ashima, how can this be different for a working woman versus a homemaker when it comes to dealing with stress?
Yeah. See, most of the women, even a study says, American Psychological Association said that they found it out that women perceive stress more in the boundaries of home. Taking care of daily work as at home, taking care of children, elders, or just simple housework. But men perceive it more in the financial sectors. For them, that is more as a stress. So, for women who are working, I think then it's a combination. They are taking care of the stresses at work, whether it's deadlines, it's what you want to deliver, there are presentations, there are just admin work,
Yeah.
and there are also definitely the financial aspect of it, as well as taking care of family, children, parents, and in-laws, and of course the home or housework.
Yeah.
So it's quite a load out there. But having said that, I also want to say that managing stress for all men, women, irrespective of the genders, as well as working and non-working population, has to be same. You've got to begin with first, starting with self-care, addressing and acknowledging that you are going through a period where you're stressful because you're getting all these symptoms, and then doing something as simple as, perhaps if you're not being able to deal, go to a counselor, go to a psychotherapist, talk about it, and then take charge of your life and start doing simple things like going for a walk for 30 minutes, exercising for some time. No matter how busy you are, you need to take out at least 15 to 20 minutes for yourself, to which we, in a very cliched way, we say the me time.
Yeah.
But that me time is very, very powerful in contributing to your health.
Yeah.
And I would suggest that you can enroll in a yoga class, you could do a little meditation, you could practice something that gives you pleasure. It could be one of your creative hobbies that you used to do once upon a time. Please go back to it. All this together helps everyone who's trying to address stress. And again, for women who are working, because they'll be pressed for time there, yet please take out 15 minutes early in the morning. You could do that, or once you're back, and they can manage the stress better.
I think that's a wonderful tip that you mentioned, that there's certain time of the day that you can dedicate for yourself.
Yes.
Especially for working women, that what I have learned is that right in the morning when you get up, before you even start your daily work, just take out that 15-20 minutes, find a mat in your room and just meditate.
Absolutely, absolutely. That's the best way actually, to dedicate a fixed time and a place.
Yeah.
And you kind of then get in that routine, and it takes about 20-21 days to get or learn a new habit.
Yeah.
And once you do that, you will really start enjoying, as well as seeing the difference in your well-being and level of stress, definitely.
We all know that, okay, we are stressed, or we might be dealing with depression or anxiety. When is that particular time that you feel that, okay, now I need professional help, I need to speak to somebody who can help?
That's a very good question, because most of the time we tend to ignore the symptoms till we really land up with some lifestyle disease, or the blood pressure goes up, or you develop diabetes, which definitely is a very big threat to all of us. So the best time is to go to a therapist or a doctor is, you identify, if you find a kind of a trend that you're eating too much, or you've started consuming caffeine too much, your habits are changing, and they're towards more of extremities, or you're crying often, or exhibiting, your irritability has gone up, and your anger outbursts are on the rise, you're feeling low most of the time, you're not feeling happy even if you are indulging in the same activities that you were doing earlier. These are subtle signs of telling you that you need to visit an expert who will then tell you what to do. Um, on your own, I think to just take care so that you don't reach a state like this is a regular practice of taking care of your uh, associating with things that give you pleasure, even if it means connecting with nature, going out for walks, attending or listening to people or reading books that would answer these questions. Then the second part is taking out some time in a week where you can indulge in certain activities, creative activities that will break the train of thoughts which leads to stress, because you are thinking 24/7 and there's a clutter. So you can create some time where you can practice painting, gardening, even cooking is very mindful. So indulging in activities that puts you in here and now mode, in the present moment, where there's a flow state, so you are just engrossed in the activity that you're doing and also enjoying that activity. This is one way. Another way is exercising regularly. Even if you don't get time to go to the gym, it's okay. Walking for 15 minutes, 20 minutes per day. You could do those exercises at home. You could do yoga, which is excellent. Go for meditation and mindful activity. This will help. Besides this, take care of your diet. Diet plays a very important role on how we are feeling. Eating the right food at the right time and the right portion is very important. More than that, go for natural stuff. Don't go for processed food. Uh, Go for seasonal vegetables and fruits. That is very helpful. Stay close to nature. And if you still find that you're not being able to cope with your emotions or thoughts, then please go to an expert to address that.
I think that is really helpful, because sometimes we feel that we want to do yoga, but your mind is still wandering. Or
Yeah.
you're going for a meditation, you still feel that it's not helping.
Yeah.
That means that you need to address something and probably seek professional help.
Absolutely. And sometimes, even when you are going through this, it's important to first check this. Are you sleeping adequately?
Yeah.
Because if you're not sleeping well, you might manifest these symptoms as well. Because your thoughts, your alertness, your energy levels will be very low if you're not sleeping adequately. And then if you're not eating the right food, again, your energy levels and cognitive, thought processes will also get hampered. So please take care of these things, and I think that will tell you that you need to go to an expert or take up these activities in your life.
Interestingly, there were a couple of girls who DM'd me on my Instagram saying that, Nidhi, we feel that there is a specific area which I get an ache, say a back pain or a pain in my nape, which tells me that, okay, you need to slow down. So
Yeah.
I think going back and listening to your body helped me a lot. Like, I understand, okay, Nidhi, you need to slow down, just rest a bit,
Yes.
and then probably resume your
Absolutely,
activities.
absolutely. So self-care, what you're saying, the most component thing that I keep emphasizing is you must take care of yourself.
Yeah.
We are so busy as women. Women are more giving, so they're taking care of the whole world, as to say. The priorities are very different. They're taking care of their children, their parents, your husbands and in-laws and family, and so it's not being selfish if you take care of yourself too. It's very, very helpful to sit down and make a list of what you would like to do, what are the things or activities that will make you happy, and what's the food, what are the kind of food items that would help you particularly. Because again, like we in this center, when we talk about integrating, it's a very, very personal thing. You have to, because we are all unique. It has to be personalized. Don't follow any diet fads that's so rampant these days, and everybody's trying new diet plans. It's important to understand your system, and it has to be very, very customized and personalized. Understand your body, yes, like you said. Understand the need of your body and respect it. and it will always help you stay healthy.
Dr. Ashima, this brings me to my next question, which is, around the societal norms that a modern girl deals with these days. She's a working woman, but at the end of the day, there are certain rules that comes with our society that we live in, like marrying at the right age,
Yeah.
having the baby at the right age, or say moving in with in-laws, which could be like a consensual thing, but you still have to do it. There have been girls who have interacted with me, and they've shared their stories where the family is not that supportive. In fact, our parents and in-laws, they might not even know about PCOS.
Yeah.
Right? So it becomes another challenge to sort of communicate what you're going through. So how does the woman deal with all of these things, and then there is PCOS, right? So what should we do in that case?
So, PCOS affects 6 to 10% of women in the society, and still not many people know about it.
Yeah.
So, when you say that, the family support plays a very important role in how women can deal with it, and that also means how they're handling the stress levels, because as it is, they're going through it, and then they're dealing with the symptoms, they're dealing with the issues that's troubling them, and on top of it, of not being acknowledged, of not being, those issues not being recognized, adds added stress or pressure on the head. So as far as the family is concerned, I think it's very important to listen and acknowledge any symptom or any discomfort or the issues that the woman is going through, and that will at least help the person feel little relaxed, or at least little acknowledge that okay, it is true and it is real and I'm going through this, and equip that person to be more resilient in dealing with these issues, because then you are equipped to take charge, because you feel that it's not only me, and that pressure of just making the other person understand, listen, I'm going through this and this and this, and there's so many issues that you just mentioned that one goes through. So family support is very essential. It can be through from the parents, through husband. That is very important, and it will help. So what they can do as a support is to listen, to create an environment which is less stressful, it is more acknowledging, and also helping if they want to try and change their routine, be it what they want to eat, providing them with those breathers where they can actually go and exercise or go and do meditation, at least have that me time and self-care time. That is a big help. It's a huge help, instead of just brushing it like nahin, it's okay. So many times I've heard women say aisa kuch nahi hai, sab ko hota hai. That sentence sab ko hota is a very, very, it just hurts you, because well, each one of us is unique, and you are actually going through those symptoms, and in your mind you're dealing as it is with the 100 symptoms, issues, thought processes happening, and then the least that you want to hear is that, oh, it's such a general thing, everybody goes through it. Having said, be self-motivated to take out that time and learn to say no to a lot of things, and not say yes for everything. If you have to say yes, say a big yes to yourself, and that will make a difference also. And I think your family then starts respecting what you want to do for yourself, and helps in a long way.
I think that's rightly said. I think communication with the family, that interaction is so important, be it any part of your life.
Absolutely, absolutely. So communication, yes, you don't just presume that the other person will know about it. I found this also many a time, like with particularly women, they expect the others to guess what's going on with you. So, so just say it. You have to say it in many words. But yes, be strong and optimistic to deal with it.
That's how us women are wired. Like we tend to overthink, or we give a silence treatment to our husbands. which is, I think, not the right practice, I
Right,
believe.
yeah.
Dr. Ashima, what are the different therapies available for one, and how do we know which therapy should we go for?
Okay. When it comes to therapies, we have to identify, is it for how you're feeling? Is it the thoughts, the emotions that's bothering you? You definitely have to go to a psychologist or a counselor to help you. But if you have health issues, you need to go to a doctor or a gynecologist for helping you there. But when I say gynecologist or a physician or a therapist, um, the integrative approach is the best approach that we are doing here, of course. But lifestyle modification is the first choice of line of treatment. So when you say lifestyle modification, definitely you need to see a nutritionist. You need to visit somebody if you're not getting right sleep. But when it comes to emotions and feelings of those low feelings of depression, you go to a psychologist who will offer you CBT, which is a cognitive behavior therapy. There'll be other therapies that they'll assess. They'll have assessments done. Talk therapy helps. Psychotherapy also, art therapy helps a lot, which comes under expressive art therapy. Besides this, I think one can go for Ayurveda treatment, one can go for yoga and meditation. These are all going to help in the long run in managing your health issues and reducing the stress and making you feel happier and healthier.
That is quite helpful. I think what is also I see is prevalent these days is girls running after a diet plan, which helps them lose weight. But ultimately, I feel that could not be a sustainable approach, because even if you lose that weight, yes, it could be an enabler. But then what happens with the stress part, which could have been the root cause? So. I feel that it's more on the integrative medicine, as you said, probably going for a chakra healing, or there's so many things. I think there's Reiki also.
When you mention about eating, you'll be surprised that when we are stressed, our eating patterns change.
Yeah,
emotional eating. Yeah, so people tend to choose wrong food with higher level of fats. They go for fatty foods. They eat, the binge eating increases, and they eat a lot because they want to it's like emotional eating. So if you're feeling stressed, you just start. Some people might just attack chocolates, some of them fries. So that is there, as well as not being mindful about what you are eating, when you are eating. So mindful eating is very important, and that will happen if you address your stress. So most important thing is that you have to acknowledge, address, notice if you have any symptoms of stress, and then address it, and all these things gradually will start getting better. And not necessarily just the going to a nutritionist. Of course, it's part of the treatment plan also.
And I think it's okay to go to a psychotherapist for a therapy. I feel that in India, people do not talk about it openly, especially in non-metros. So,
and I'm so glad that you brought this up, because it's perfectly fine to go and talk. It's as simple as, if you had a fever, or you got fever and you would go to a doctor for medication. Psychotherapy or talking to a counselor is almost like getting some tips and guidance from a person who's non-judgmental, who would also give you things, who respect you and listen to you more carefully, and not try to give you advice, but will show you a path going forward. So it's a very, very helpful process. And talking helps, because at least you declutter. You don't stay with the same thoughts all the time, and you get a clear picture, a roadmap ahead. So I'm so happy you brought this up.
And I think, Dr. Ashima, sometimes, as you mentioned, that people do give you advice, and especially when you talk to your own parents who some cases maybe supportive or non-supportive, or the friends, but their opinions are mostly biased. So when you speak to a professional, then I think it is more helpful to deal with it in a sustainable way. With some questions from our Instagram followers, and we have shortlisted the 3 best questions, and those entries will be winning a giveaway from us. Okay, so the first question is by Saloni Baveja. She asked that how to stop thinking over little things that happen at workplace and how to avoid these.
Okay. See, if you are, Saloni, if you are in a habit of thinking those things again and again, and you find a repetitive pattern to it, the best therapy is CBT for this, you know. So if you can go to somebody who can help you with the cognitive behavior therapy sessions, it will help you a lot. But giving you a tip right now, I think is meditation or any mindful exercise will help you a lot, because it will kind of help train you to stop this continuous train of thoughts by stopping it or creating that pause moment through meditation or mindfulness activity. I think that will help her.
Yeah, because I think there's certain things that somebody else also brought up, that we come back from work and there's a different role that we're playing. So we had a role of a working women, now we are at the household women, while men, not being biased, but they sort of come back home and then mostly everything is lined up for them. So it's very, very important for us women to sort of shut ourselves for a role and then probably take another role and not think about too much.
See, sometimes we really can't do much about our thought processes. Like I said, we get more than 60,000 thoughts per day. It's like, it's just coming. What helps if you want to really, align these is being more organized. So, and managing your time well, and prioritizing what's to be done, what is really important and it needs attention, and what is not. Because if we start connecting with so many thoughts throughout the day, definitely we'll feel tired and stressed, and we really won't know what to do. So best thing is to make a kind of a list of things that needs immediate attention, which are important, and make another list which can be done later on, and not try to be a perfectionist. Don't try to be the perfect employee there, or a professional who's a superwoman and who can manage everything. I think that inner dialogue has to be addressed as well. Well, you're good and you're doing everything well, and these things can wait, and you can be more organized. That will also help her.
Yeah, I mean, it's okay if you are ticking off those 8 items out of your 10 list items. It's okay.
And it's okay.
It's okay.
And it's absolutely okay to be not okay also. So sometimes, sometimes if you are not being able to manage everything as you visualize or you plan beginning of the day, tell yourself it's okay, I can do it tomorrow. But then to do that, I think it's important to first check your list, what is most important, and it needs immediate attention, because you have to address that. Definitely.
Yeah.
That will help as well.
Yeah, great. Next is from Kunjala Salunke. What can I do in the very moment that I'm stressful but I need to deliver or interact?
Yeah. So if you are stressed and you find that you are feeling anxious and your heart is pounding fast and you're breathing fast and you really don't know what's happening, there's a funny feeling in the tummy. So the best thing is to take 3 deep breaths. The abdominal breathing exercise, which are taught even in yoga and pranayams and all, that is very helpful. But just sit down and take 3 deep breaths. So which should come from your abdomen. Most of the time, if you want to check, we do shallow breathing if your chest is moving more, and if you're breathing deep, then the body goes into a state of calmness and relaxation. So breathing short, 3 deep breathings will help immediately.
And I think you brought a really good point, where I feel that in today's world we've stopped breathing properly. We've
Yeah.
sort of forgotten.
Yeah.
And I noticed that when you look at the animals, say I have a pet at home, and I feel the way he breathes, it's so natural. Like the babies, they breathe very, very
Naturally, you're absolutely right.
But we
Absolutely right.
are
Yeah.
we're not breathing right.
We're not breathing. So that's, in fact, I'm so glad that you are bringing up these things, because that's what this whole integrative thing is all about. Because you have to be in touch with yourself. You have to notice how you are living your day, and if you find that you're feeling little restless, that's the time to leave everything, sit down, and observe your breath. It's as simple as that. You could be breathing naturally. Just sit down, shut your eyes, just sit down and relax, and just observe your breath going in and going out. That itself calms your whole body.
Yeah.
And the whole response is so beautiful, that if you're gently just observing your breath, you inhale and then you exhale slowly. So that process, that exercise itself will put your body and mind into a state of total calm and relaxation. So yes, breathing properly is very important.
And I think you can do it at your desk, in a meeting room, probably in the
Yeah.
car when you're stuck in the traffic
Yeah,
jam.
absolutely.
Anywhere.
It can be done before your presentation. It can be done a couple of times in the day.
From Nilufer 2468, they say that being a hostler, sometimes I feel very low. What to do?
Okay. So, yeah, away from home, away from family, definitely makes you feel low. So even when managing stress, or when I was talking about lifestyle modifications, social connectedness, or being connected with your family, friends, loved ones, plays a major role in keeping our emotional well-being on top of. So I think what you should do is to reach out to your friends, to your family, and make new friends in your hostel. Maybe you can just go and chat with them. If not, listen to good music. Music really helps and peps you up. And find ways to maybe talk to your friend or your family members. These days it's so easy, FaceTime and WhatsApp video. So do check yourself whether you're connecting with your family, friends more often. And because in a hostel, and if you are studying and you are doing some course, there are times when we just say that, oh, we are so busy, we are not even talking to anybody. But do take out time to connect. That will really help you feel better. But if this feeling of feeling low, loneliness is more, I would suggest please see a therapist or a psychologist or simple counselor and talk to them. They will also guide you and give you some tips on dealing with feeling of loneliness and feeling low.
And I think with PCOS, there's certain sort of a situation where you're dealing with depression.
Mm-hmm.
You don't feel like meeting anybody,
Yeah.
and you don't want to go and see anybody. But then, it's all about taking health in your hands.
Yes.
You have to take that step, saying that, okay, I will do something about
Yeah.
it. What are the resources which are available for me? And I think, as Dr. Ashima rightly said, it's just about taking that initiative for yourself, because you have to make things right.
So because it's important to address these feelings, and I want to emphasize that if you're feeling low, if you're feeling lonely, do not sit with these feelings. You need to talk. You need to, with anybody you feel comfortable with. It could be somebody from your family or your friend to begin with. And definitely contact somebody, a specialist, a counselor who can guide you. And even if you don't feel like you emphasize, and it is an important aspect, because when you are feeling like this, you don't know what to do.
Yeah.
So have ready resources, and have a set of people who recognize that you are feeling different, and motivate you to take these steps and reaching out.
Thank you guys for sending in your questions, and I'll shortly reach out to you for your giveaways. Dr. Ashima, this conversation has been extremely helpful. I think the little things that we spoke about for our daily lives we should start putting that to practice. Anything that you have to share for our PCOS community?
Yes, I'll be very happy to say that. So take care of your mind, take care of your thoughts and feelings, and the body will follow. You know, little mind-body connection is there. Reach out if you have any issues or emotions that you're not being able to handle yourself. It's okay to take help. Then take care of your lifestyle. Sleep adequately, exercise for some time, movement is very important, and eating the right food, taking care of your thoughts. Then connectedness, you know, social connectedness is very important. Maintain connection with your friends and family, and take out time for relaxation. That is also very important because that comes in the section of self-care. uh, Indulge in activities or which gives you happiness and pleasure. It could be any of your hobbies like painting, gardening, doodling, or just cooking also. And then practice gratitude. Be thankful for things that you have in your life, and shift your focus to things that you are gifted with rather than the have-nots in your life. Because you know, making, when you're grateful, you are thankful, you also now it's backed by science as well. You create a sense inside and a response which is healthy, so you stay healthier as well and stress free. And most importantly, take pride in being you, because you are more than just this, you know, this definition of, okay, I have PCOS or I have this. You are more than that, and you're much larger than that, and seek that bigger you, and take pride in being yourself and enjoying your life and flourishing and living a life which is full of happiness and good health. So I wish you all the best.
Thank you, Dr. Ashima, and I think from both of us, we want to wish a very happy International Women's Day to everybody
absolutely.
who's watching.
Yes. And
and-
stay healthy and stay happy.
Okay.
And particularly stress free.
Stress free. Thank you for watching. If you like this video, please share your comments and share other topics that you would like me to cover in the future interviews. Please follow PCOS Club India on Instagram and YouTube. Thank you for watching.